clinical vignette titled A Rare High-grade Neuroepithelial Tumor of the Central Nervous System in a 36-year-old patient. High-grade neuroepithelial tumor is a newly emerged entity of the central nervous system malignancy characterized by a BCOR alteration. It is a rare malignancy that affects only 0.6% of children between 0 and 17 years old. To our knowledge, none of the cases were identified in adults greater than 27 years old. This is the case report of a 36-year-old right-handed female without significant past medical history who presented to the emergency department with worsening left facial, upper and lower extremity weakness. She reported history of multiple left-sided facial spasm of 5 months duration after she underwent botulinum toxin injection after being diagnosed with bruxism. 2 months after the facial spasm, she noticed weakness in the left face, arm, and leg, for which she was evaluated by neurology in the outpatient clinic. Subsequently, MRI of the brain showed a large tumor in the right frontal lobe. Worsening symptoms and imaging findings prompted her to go to the ED for evaluation. Physical exam on admission was remarkable for left cranial nerve 7 palsy, decreased strength 4 out of 5 in the left upper and lower extremity, left lower extremity with increased tone, hyperreflexia, and clonus, and decreased sensation in the left side of the body. Repeat MRI of the brain reports 6.6 centimeters hypodense mass with scattered areas of calcifications centrally and peripherically, which extends to the right frontal cortex with ipsilateral mass effect. Patient was started on seizure prophylaxis and steroids until she underwent right temporoparietal craniotomy for biopsy and resectional dilation. Biopsy of the mass revealed high-grade neuroepithelial neoplasm with perivascular pseudorossettes, calcification, high mitotic activity, and necrosis. Methylation profile demonstrated BCOR internal tandem duplication with EP300 fusion. The tissue expressed Ki67 proliferation index of 50%, also demonstrated positivity for p53 wild-type pattern, OLIC2, Vimentin, D240, CD56, and weakly positive for S100 protein and synaptophysin. Postoperative physical examination showed improvement of the left facial 7 palsy and left side weakness. Further imaging was negative for metastatic disease. Patient is currently on seizure prophylaxis with plans for chemotherapy and adjuvant radiotherapy. So high-grade neuroepithelial tumor with BCOR alteration was recently classified as a new type of tumor among those previously known as a primitive neuroectodermal tumor. The mutation of the BCOR gene appears to disturb organogenesis and played a critical role in the development of a wide spectrum of human tumor types. Not many cases of these tumors have been described in the literature. These are rarely seen in young adults and difficulty to differentiate from other neuroepithelial tumors for which the DNA methylation profiling needs to be obtained in order to differentiate them as it was done in this case. To date, management with dedicated protocol has yet to be fully defined, but relies on surgery, high-dose chemotherapy, and radiotherapy. Thank you.